Okay, so chapter 14 is concerning substance abuse. And the first thing we have to talk about is some terminology. So, the term substance abuse or chemical dependency is the term that has replaced other terms that were known as addiction or alcoholism, but those terms are still used, and you will still hear these terms um, come up if you go to any type of like say AA meeting or Narcotics Anonymous meetings. The old terms are still referred to. And the definition is the inappropriate or unnecessary non-medical use of drugs or chemicals that impairs a person's function in some way to some extent. Now, the substance is desired because it produces euphoria, a sense of pleasure or high, or it may alter one's sense of reality or decrease one's awareness of people and the environment. So it's usually some desired result to take a person away from a current situation and to maybe get some release from the stress in somebody's life. A habit means a practice of using drugs or other substances at a regular and frequent interval. Could range from constant coffee drinking or cigarette smoking to use of illegal or street drugs. Dependence includes both physiologic and psychological aspects. Physiologic dependence is where the body has adapted to the presence of the drug or chemical so that discontinuing the drug results in withdrawal signs such as tremors or abdominal cramps. The term psychological dependence refers to a continuing desire to take the drug to be able to function. And tolerance, that term means the body adapts to the substance in time so that an increased amount of the drug is needed to produce the same effect. Excuse me, we can throw in that term addiction. Addiction is an older term, like I said, but it's still in common use. The uncontrollable compulsion to use a substance, often with serious consequences for the individual or the family and or society as a whole. Impaired judgment can cause the individual to participate in activities that are potentially dangerous, like driving an automobile and causing an accident, or using machinery while impaired, or violent crimes. So, abuse substances by mode of action. What drugs can do is they can depress the central nervous system. So, CNS suppressants, tranquilizers, things like alcohol, or benzodiazepines, or opiates. Narcotics or painkillers which cause euphoria or drowsiness. Stimulants, coffee or amphetamines. Um, Psychedelics or hallucinogenics, which alter a person's perception and awareness or produce illusions, like LSD or mescaline. Illegal or street drugs. These are some of the types of drugs and some common terms for them, and they probably have changed. There's probably a lot of newer street names for these. These are widely available, costly, and dangerous because content is unpredictable many times and can result in overdose or toxic effects. Amphetamines are also called speed, uppers, um, phencyclidine, PCP, angel dust. This is an anesthetic used in veterinary medicine, and the patient can become violent. Cocaine, snow, crack can result in heart attack. Methylene dioxymethamphetamine, MDMA, designer drugs like ecstasy, that was the chemical name for it, MDMA, chemically modified to provide special effects and avoid legal restrictions, gives a feeling of euphoria and energy. And there's also methamphetamines as a category too. Okay, causes of substance abuse. It's been attributed to heredity. Some cases of addiction seem to show a genetic link or recur from one generation to the next. Disease, alcoholism, and addiction has been considered a disease for quite some time by many in healthcare. The ready availability of drugs, fairly easy to get anything you want these days if you really want it. There's a lot of black market sources and places on the street where you can find contacts to get what you want. Increased medical use of anti-anxiety agents. These are very addictive. Benzodiazepines as a whole are extremely addictive. Increased acceptance of alcohol and marijuana as recreational tools in all age groups, and this is increasingly getting worse, and these are gateway drugs. The media presents mixed messages about substance abuse. When discussing high-profile celebrities with addictions, it almost comes across as being glamorous. Many young people associate success and fame with drug use. General indications of substance abuse. And this varies widely, it's subjective, varies from person to person, but changes in behavior. Person may not act like they always did. They may be irritable, they may be tired, they may have a different appearance. Their eyes may be red or glassy. Their personality can completely change. Daily living patterns, not showing up for work, school, or other responsibilities. Work habits, poor performance, not feeling well enough to be at work. Frequently, the person may be defensive or embarrassed when questioned about drug intake. They may make excuses for it, or they may be in denial. So, a pattern of behavior develops that any stress requires a pill or a drink, and it's called the vicious cycle. So you need a depressant to relax or to sleep, then you need a stimulant to wake up, and they have less concern about their clothes and appearance, more excuses for time and performances, stronger efforts to acquire substitute drugs, eventually criminal activity. And actually, any healthcare worker should be sensitive to the issue of substance abuse and be able to look for the signs and the changes in their patients over time to indicate that there might be something going on. Potential complications of substance abuse: overdose, lethal combinations of alcohol with other depressants or narcotics. Common anecdote: naloxone for a narcotics overdose. Withdrawal. Common signs: irritability, tremors, nausea, vomiting, and stomach cramps. Increased blood pressure, psychotic episodes, and convulsions. It's safer to experience withdrawal under medical supervision or in a hospital or detox center. Things like ecstasy can cause marked elevations in blood pressure that can cause brain damage. There's a lot of things that can happen. Benzodiazepines and alcohol can result in brain damage and a coma. So there's a lot of things out there where a synergism can produce a very extreme effect where one medication may not do it alone. And some of these medications are very lethal, and people do not know the damage that's occurring until it's very far advanced sometimes. Okay, so pregnancy. Many chemicals can affect the fetus, causing congenital defects. There's fetal alcohol syndrome, which causes the characteristics physical and facial abnormalities and also mental impairment. Smoking can result in low birth weight and irritable babies. Also, increased incidence of stillborns and miscarriages. Cocaine and barbiturates can lead to addiction in the newborn. And these newborns have to undergo withdrawal therapy after birth. Very, very sad. Cardiovascular problems. Cocaine and amphetamines cause irregular heartbeat and increased blood pressure and may lead to heart attack, stroke, or heart failure, perhaps even fatal at a very young age. Psychedelic experiences. LSD, lysergic acid, diethylamide, and PCP lead to increased but unreal and distorted interpretation of sensory input into the brain with little control over the experience. The experience can be filled with negative emotions, acute fear, panic, and depression, increasing the risk of suicide. Infection. Hepatitis B, HIV, common in drug abusers who share needles. Alcohol can result in a liver disease. The cirrhosis is called Linnaeus cirrhosis from chronic alcoholism. And destruction of the liver doesn't present with obvious signs and symptoms until the condition is well advanced and irreversible. Nervous system damage. Chronic alcoholism can cause severe brain damage from neurotoxicity and malnutrition. A combination of Wernicke's syndrome, manifested by confusion, disorientation, and loss of motor coordination, and Korsakoff psychosis involves altered personality and amnesia, and these are common. Antabuse is a deterrent for alcohol abuse. It causes unpleasant reactions, severe headache, vomiting, difficulty breathing, and visual problems. This is a medication that's used to help treat alcoholism. And AA and family support groups like Al-Anon are also very important to helping people with addiction. And also there is Narcotics Anonymous too to help with these problems.